What medical conditions related to the left ovary can affect an individual's gender identity?
Hello, and welcome. Today we're exploring the complex world of ovarian medical conditions, specifically those related to the left ovary, and how they might impact an individual's gender identity. It's crucial to underscore that gender identity is primarily a psychological and social construct, not determined solely by biological factors.
What is gender identity?
Firstly, it's essential to understand what we mean by gender identity. Gender identity refers to one's internal sense of being male, female, neither of these, both, or another genders. This sense of self is typically developed during early childhood and is sometimes described as an innate knowledge or understanding of one's own gender.
Can ovarian conditions affect gender identity?
Looking at ovarian conditions and their potential impact on gender identity, it's important to clarify that while certain medical conditions might affect hormonal balance and physical characteristics, they do not directly determine or alter an individual's gender identity. The primary role of the ovaries, including the left ovary, is to produce sex hormones and eggs for reproduction. Medical conditions that affect the ovaries can influence these processes, potentially leading to various physical symptoms or reproductive issues.
What are some conditions related to the left ovary?
Some conditions related to the left ovary, although they often affect both ovaries, include polycystic ovary syndrome, PCOS, ovarian cysts, and ovarian cancer. PCOS can lead to hormonal imbalances, causing symptoms like irregular periods, excessive body or facial hair, and obesity. Ovarian cysts may sometimes cause hormonal changes, but they're usually non-symptomatic. Ovarian cancer, on the other hand, is a serious condition but typically does not directly affect hormone levels unless it involves removal or damage to the ovary.
How might these conditions intersect with experiences of gender?
Physical symptoms from these conditions might interact with an individual's experience of their body and potentially their gender expression, but they would not directly change or determine their gender identity. For instance, a person with PCOS who identifies as female might feel distress if they experience excessive body hair, a trait often associated with masculinity, but this doesn't change the fact that they identify as female. In conclusion, while conditions related to the left ovary can lead to various physical and hormonal changes, it's vital to remember that these conditions do not directly influence a person's gender identity. Gender identity is a deeply personal, complex, and individual aspect of who we are, and it encompasses much more than just our biological or physical characteristics. Respecting each person's self-identified gender is key to understanding and affirming their individual experiences and identities. Thank you for joining this discussion, and we hope you found it informative and helpful.